Let's meet someone who is revolutionising leading the charge to end renal dialysis by 2050. I'm Kate Save. The Inspired CEO starts now. Welcome to The Inspired CEO, where each episode we explore the innovative wellness practices that are driving success and longevity in the modern business world. In this interview, we speak with Chris Forbes, who has been the CEO of Kidney Health Australia since October 2018, leading efforts to end dialysis by 2050. With over 20 years of leadership experience, he advocates for early detection, prevention, and increased transplant rates. Committed to health equity, he works to address kidney disease's impact on First Nations communities and to drive sustainable innovation. Thank you for joining us today, Chris.
Thanks so much, Kate. Great to be here.
Well, I'm fascinated to have you in here today because there's so much conversation about diabetes. However, I certainly don't hear as much in the media about kidney health. So how big is this problem?
Look, kidney disease is a largely undiagnosed disease. There's more than 1.8 million Australians who are walking around today with early markers of the disease, but simply don't know it. And that's why so many people are crashing into the end of kidney disease, which is kidney failure, because you can lose actually 90% of your kidney function and have no visible symptoms. So it hides, and we're out to bring it out into the sun, I guess, and to start diagnosing it more readily.
And I think the scary part of it is that people don't really understand, once you have end-stage kidney disease, how much that impacts your life. So what does it look like for someone who is in the later stages of kidney disease?
So when people reach kidney failure, and that's when the kidneys are no longer able to clean your blood and manage your blood pressure, etc., you need to have some sort of treatment to replace their function, and that generally is either dialysis or a transplant. There's about 15,000 Australians currently receiving dialysis, and that means for the patient, it means 5 hours at a time, three days a week to receive dialysis, and then all the burden that goes around it, the transport, feeling unwell. And that not only impacts them, it impacts their families and their carers. It's a massive impact in not being able to have a holiday, feeling tired, feeling unwell. So, you know, it's not ideal, and so we want to get people off dialysis.
And I can speak first-hand experience, having a very good friend of mine have end-stage kidney failure in his early 60s, and he never made it to his 70s. So I'd go with him for renal dialysis, sit there for 5 hours, drop him off, pick him up sometimes. And the number one thing that he told me is, I wish I'd listened to my doctor. So when he was 40 and he was a pilot and he had a big printing company and he was living the high life, he was personal training every day, but he never took care of his diet or his alcohol consumption, and it all ended up catching up with him, and he thought he was invincible at 40, and then as the decades went on, he started to get the first diagnosis, the second, and then by the time he got to his 60s with that lifestyle, it really caught up with him, and it got to the point of no return. And I know that he would be really happy that we're having this conversation because he wishes that he'd told his younger self to listen to his doctor.
And look, the conversation is timely because in the past, if you were diagnosed with kidney disease early, there wasn't a lot you could do. It was, you know, manage your diabetes, potentially lose a bit of weight, stop smoking, etc. But now we have transformational new medicines available in your GP. That if we can diagnose it early, we've shown that you can stop or slow progression for up to 15 years and avoid kidney failure. So, you know, patients talk about every day not on dialysis is a good day. We know it's a life-saving treatment, but there is a better way, and we're really committed to turning off the tap. Diagnosing it earlier, stop people from getting there, and stop this massive burden of dialysis.
And so, I guess, what role does our general health, maybe our lifestyle, play in kidney disease?
Oh, look, it's a massive precursor to kidney disease and to diabetes. So Kidney disease can live by itself, but it also lives with diabetes,
Right.
with cardiovascular disease and high blood pressure. They often live together, and a person can have 1, 2 or 3 of those conditions. And so some of those precursors are your diet, your nutrition, are we drinking water versus soft drink, these sort of decisions that we're making. So getting the right amount of exercise, managing your weight, those sorts of things. They're simple things that we're all told as kids,
Yes.
but we often don't do it. And so it's really about, and we often don't act until we're forced to.
Yes.
So the ideal would be that we do better than that. And so part of what we want to do is to get people living a healthier lifestyle. And so we want people to live longer, but we also want them to live healthier, not just longer and be on lots of medications.
And so I must say as well that I've read that perhaps you were living in the dark about actually knowing about kidney health and what a big, burden it is to health with kidney disease. Because prior to this role, you're not a doctor, you weren't in the medical field. How did you start your career? Where did you start?
Look, I grew up in a really small country town in Western Victoria, a town of about 200 people. My dad was the country pharmacist, and in that role, really important part of the community. He was also the ankle strapper for the footy team and the netball team. We had, because he was a respectable person, he had the key to the pool. He held all the. He was also a bit of a vet. People would bring their cats and dogs into the pharmacy, typical of a small country town. So I was exposed to care and health, I guess, from a very early age. And I used to work in the chemist shop as a kid. And then my mum came off a farm up in the Wimmera. And so, those country values and that country exposure is how I grew up. And so now I'm really, I took a different path and have had a varied career, including corporate. But now I get to have the best of both worlds. I married my commercial skills with my desire, I guess, to help people and to help the community. And so I feel privileged to do that. And with the cause, it's such an undiagnosed disease, but there's such great opportunity. It's great to come to work every day. Yeah,
and so you started with the entertainment industry or agriculture
first?
Agriculture
first, and I moved around Australia. I lived in Shepparton and Horsham. I went to Bundaberg, etc. And then I ended up in Sydney. I found that I was probably more in love with business and commercial than standing out in the middle of a paddock for hours doing research. And I put myself through a business degree after I did my science degree. And I ended up living in Asia doing some agricultural work across the Asia-Pacific region. And so I sort of went from that world, my core skills being marketing and commercial, I guess, then made a transition into sport and entertainment.
And then coming round to working for a not-for-profit. And so what has been some of the milestones in your career that maybe have led you to being as passionate as you are about what you're doing now, even though your foundations didn't come from this place?
Yeah, look, I think for me, I've always loved the challenge. So that's been one of my key drivers. I've never really planned my career like so many people do. I've probably gone and said yes to opportunities where maybe I wasn't quite ready for that, but you take it on. I remember I was sitting on a plane coming back from Bangkok, sat next to someone who was recruiting for the Sydney Olympics, and I ended up a month later as the marketing manager of soccer for the interstate football. Wow. And I literally sat at my desk doing the marketing plan with a book on my lap, how to market sport, and it went from there. So I've always taken on challenges, and I think with this role, the challenge initially was around a commercial challenge. So charities like us, especially when COVID hit, we lost all our community fundraising, car rallies, walks, all that money that we desperately needed to survive was gone. And so we had a commercial turnaround need, but within probably 2 weeks of starting, I visited a renal unit in Adelaide and I saw the realities of this disease and what I had never been exposed to. And so buying into mission took no longer than 2 weeks. Gosh. And so since then, I've been really driven to the point where we're 6 years into my sort of time, I feel as though I'm just getting started. And I feel that with our desire to end dialysis by 2050, that's about having aspiring conversations and bringing collaboration to this because we can't do it alone.
And so you had a really interesting initiative back in the COVID times with Red Socks. So tell me about that.
Well, actually, when I interviewed for the job with the board, I wore a pair of red socks because I felt just didn't have the brand awareness. We didn't. So I wore them, and I actually forgot that I did. And it was right near the end of the interview process where one of the directors asked me, "I see you wearing red socks. What's that about?" And so it was exactly that's the reaction I wanted. So I said, well, actually, it's to start a conversation around this disease, which is not talked about. It's hidden away in the back rooms of hospitals and people's homes. We needed to bring it out into the sun to have conversation around what is it, how do we get in front of this disease, etc. And of course, we use it to raise funds. So now we do a Red Socks run every year. People raise funds for us, and it starts a conversation.
Absolutely, and I think there is a lot more in the public eye around. So if someone has cancer and they're having oncology treatment, perhaps having chemotherapy, you see them hooked up to the machine, and you see that. With renal dialysis, it's not in the media. People don't really understand that 5 hours, 3 times a week to completely filter the bloodstream, and what a barrier that is to living a free life.
And it's not just the 5 hours. So your body's actually working hard while you're sitting in that chair because the blood's being pushed through a machine. So patients come and talk to me about having a nap in the car park afterwards for a couple of hours so they have the energy to then drive home. Or a carer has to come and pick them up, and often it's a 2-hour drive home sometimes. So that's debilitating at times and really impacts. And so we know that 50% of people on dialysis will experience depression at some stage, and more than 80% financial hardship because they're restricted in their work.
Of course.
And the loss of productivity to Australia. This is a $9.9 billion problem every year to Australia on our economy. A lot of that is lost productivity, but a lot of it is also the cost of dialysis.
And when you think about the depression, I really remember talking to my friend before we lost him about going on holidays and taking a break from this, but you can't take a break from your dialysis. So he had to go on a waiting list to be able to go to a hospital or a facility up in Cairns so that he could get away from the cold winters in Melbourne after 5 or 6 years. And he just said, I really want to go somewhere. And he managed to find a unit that he could do a couple of weeks at. But in the middle of his holidays, 15 hours a week, he was sitting there attached to a dialysis machine, let alone the travel in and out of where he was going for holidays. And the cost of that was really high.
And we now have 3 dialysis buses that are mobile that we put in holiday locations in New South Wales, Victoria, and Queensland. We're starting in Queensland. And so patients can actually book in, go with their families. There's 3 chairs on each bus, and you can actually have a holiday. And so that is life-changing for some because, I've visited them obviously, and you have the patient getting their dialysis and then the next day they're kayaking down the river with their families. That's time you can't buy, right? And so it's really important. And so we'll never, in our quest to end dialysis, we'll never leave the patient behind. We'll always fight for them and be their voice. But we do believe that it has to be better in the future. We need to stop people getting to kidney failure for the sake of the patients, for the sake of their families and carers, but also for the sake of our environment and our hospital system. 1 in 6 hospital admissions in Australia is kidney related because of dialysis.
1 in 6.
We're clogging up the hospitals with this, right? So it has to be a better way. We've got to turn the tap off.
And so if there was 3 things that you would get all Australians to do for preventative kidney health, what would you do?
Look, I think prevention's it's a really vital part of health for all of us. And so I think having relationship with your GP, etc., to get those regular health checks, I think it's really important. Just like going to the dentist is to get your teeth checked and cleaned and avoiding cavities rather than waiting till they appear. So I think that preventative approach, it sounds like preaching a little bit, but look, we have to eat a little bit better. There's so much hidden sugars in our food, in soft drinks and in some of the so-called health foods, which are full of sugar,
as we've discussed. The cereal aisle and the muesli bars, and it's So
I think we don't need wholesale change. We need people to start to make small changes can make a big impact. Start small and go from there. Get a little bit more exercise. These are the things that can really help both, in your, once you come out of your teens and things start to catch up with you, but for later in life to avoid chronic diseases, it's good to have that start in life.
And I guess starting off in agriculture in your very early career, I think you would have the most fundamental knowledge about what really good whole food nutrition is. So what are simple things that people can take away? What can they eat?
Yeah, look, I think meal planning, what I've found, and I'm no saint, right? I live a busy life and I've got two teenage girls I look after, and so time poor at times. So, but what I think you can do is you don't have to have, what I find works for me anyway, is you don't have to have a fancy different meal every night. You know, you can meal plan for the week and buy some fresh veggies, etc. And look out for what's available now at this time of the season that's not so expensive, because sometimes it can be expensive. And so just simple meals, fresher foods rather than the processed foods, etc., are certainly a way in which those small changes can make a difference.
Now, you mentioned as well that you want to make a difference in the lives of First Nations people.
Yeah.
How does kidney disease affect First Nations people?
Look, it's much worse in First Nations peoples, and I have to be clear, I don't speak on behalf of First Nations people, but I want to be a really good ally for them to support them in their kidney health. So whereas it may affect 1 in 10 non-Indigenous peoples, it'll affect 1 in 5 Indigenous peoples. And so and a lot of that is social determinants that they're facing, etc. So we've done a lot of work in creating guidelines for GPs and healthcare professionals around the detection and treatment with a First Nations overlay. There's significant racial bias in our health system for First Nations peoples, and also the more remote you go, it's more difficult to get access. And so
is renal dialysis available to some of these people in these remote communities?
Look, it's difficult because often elders, etc., the people need to come off country to receive that dialysis treatment. So there is some investment happening right now to have more dialysis on country so that people don't need to leave. And, I think that's fantastic. But the transformation, if we're really going to make a difference, we have to stop First Nations and others from getting to kidney failure in the first place, and that is early detection and then prevention of progression through a range of things, medications and then lifestyle, fresh food, fresh water, those simple things that we all take for granted in the city but aren't available sometimes when you go very regional and remote. And often the price of fresh fruit and vegetables can be more expensive.
In those remote
communities.
It's unbelievable.
So we need to find sustainable ways to address that if we're ever going to transform.
And we mentioned briefly that there was a look at a sugar tax. So this has been going on for about over a decade now, and even since research has come out to show that this may be a bit of a deterrent to the huge amount of sugar that Australians are taking in. What are your thoughts on the sugar tax?
Look, I think anything that we can do to reduce sugar in food is a good thing, because a lot of the sugars are hidden. You see them, and as you mentioned, the cereal aisle or the muesli bar aisle, where it's got a big sign on the front of the pack that says no added sugar. But if you look at the ingredients, there's high levels of sugar in it, just they haven't added any.
So there's a gap in education.
There's a gap in education, but we shouldn't, as consumers, we shouldn't have to work hard to find out whether something's got a high level of sugar or not, or a high lot of fat or not. We shouldn't have to work. It should be much more transparent and allow us to make, as parents, easier decisions on which one to choose.
Yes, and I think that's a really good place to go next, is what could this look like for the next generation? So with our kids growing up now with ultra-processed food being, from the day they're born, baby food all being 100% processed in pouches, and people are time poor in this convenience. Do you think kidney disease is going to increase?
Well, some of the things that drive kidney disease are the rates of obesity, rates of diabetes, etc. So that we know that that's increasing. And with kidney disease, the impact is this. If you go back 25 years, it was about 18th biggest killer in the world. We know that in 2050, if we don't intervene now, it's going to be the 5th biggest killer. And that's because of the rates of obesity and diabetes, etc. So we have to intervene now. So whilst addressing the social determinants of health is a challenge, talking prevention is often a challenge because it's such a long payback. That it doesn't get the funding or the focus that it deserves. We're not waiting. we're going to jump in now and we'll focus on early detection and preventing progression, and then we'll work backwards to stopping people from getting it in the first place.
Fantastic. And lastly, what do you do for your health? How do you first manage your work-life balance and your 2 daughters and then your own health?
Look, I think for me, exercise has always been so critical. So when I stopped playing, competitive sport, as your footy and cricket and those sorts of things, I've always run. And then if I don't take control of my own health, no one's going to do it for me in terms of that. If I can't function mentally in a great way unless I'm getting my exercise. So these days, I'm swapping out running for cardio gym. I started swimming. I've even dipped my toe into some ocean swimming recently because your body needs to recover and those sorts. And there's nothing better than you have your exercise and you're ready to go. So my mornings are really important. I do it before the kids get up, before I go to work, and then I block out till 10 a.m. every morning in my calendar as my time at work. So that's when I get my thing. So the work-life balance thing, I think, is it's more of a blended life. Like when I was a Ticketmaster, my phone could go at 7 p.m. because there's a barcode issue at one of the footy grounds and you need to get involved. You just got to jump in, right?
You can't have those crazy footy fans waiting out the front.
That's right. You don't want to upset the members, right? But the next day, on the Monday, I might be able to take my kids to school instead and drop them off and have that time. So it's more working work and life together. But I do know that I have to look after myself. I have to get my exercise because that's when I'm at my best. And if I'm at my best, then I can portray that to my teams.
And I think for your children as well, you're obviously an incredible role model. So thank you very much. And I'm really glad that we can make some noise about kidney disease and try and get this more out there as an awareness piece.
Yeah, look, we're really grateful for the opportunity because it's not getting enough attention. It's really important, but the best thing about it is we're just not coming with letting people know that there's a problem. We're coming with, we have answers, we have solutions, we know what to do, and we're really committed to help those people who don't have a voice.
And when is the Red Sox next run event?
Yeah, look, we're looking at October for that. And so, we're looking for people to get out. And what we ask them to do is actually to walk, run or ride 60 kilometres because it's 60 hours a month that people are on dialysis. So it's just a reflection of, they see, 60 kilometres is a long way. Well, imagine spending 60 hours in the chair. So get with your team, do it together as a team, come to our website at kidney.org.au, you can sign up, and we can't operate without those funds, and rest assured those funds go to helping people who need it the most.
So thank you so much for coming in today, Chris. This is the Inspired CEO, and we'll be right back.